amendment.
Thank you, Mr. Chairman. I rise in objection to this motion. This amendment was a bad idea when it was included in our legislation last November. It remains a bad idea today. Then as now, the motion attempts to hold health care hostage to abortion politics and ignores the language already in the bill prohibiting federal funds from being used to pay for abortion. And then as now, it attempts an unprecedented overreach of women's basic rights. On this first point, this ban existed long before this particular amendment came up last November, and it currently exists in the Senate version of this legislation as well. I will say it one more time, since for some reason too many of our colleagues have not gotten the message, or why Congressman Boehner have willfully continued to repeat falsehoods about it. Other than the situations accepted by the Hyde language, as has been the case for years now, no federal funds are used for abortion or can be used for abortion in this health care package. I might add that this reaffirmation of the ban is a concession I and the rest of my pro-choice colleagues made very early on to reach common ground on this eternally contentious issue. We made this concession because we know that abortion has always been a matter of conscience on both sides of the issue. And the health care bill was not the place to litigate abortion. Meanwhile, access to quality, affordable health care coverage is literally a question of life or death for millions of Americans who have already waited too long for us to act. Right now, an estimated 45,000 Americans die each year because they have no health insurance. So holding up this bill to play politics with the abortion issue is emphatically not a pro-life stance. Let me just read to you some excerpts from recent articles and letters in the last couple of days, and I would ask the chair if I can include these letters into the record. A letter by Sister Carol Keenan, who is the Catholic Health Association President and Chief Executive Officer. CHA has a major concern on life issues. We said there could not be any federal funding for abortions, and there had to be strong funding for maternity care, especially for vulnerable women. The bill now being considered allows people buying insurance through an exchange to use federal dollars in the form of tax credits and their own dollars to buy a policy that covers their health care. If they choose a policy with abortion coverage, then they must write a separate personal check for the cost of that coverage. There is a requirement that the insurance companies be audited annually to ensure that the payment for abortion coverage fully covers the administrative and clinical costs, that the payment is held in separate account from other premiums, and that there are no federal dollars used. Let me quote from an article by Timothy S. Jost, who is a health law professor. It was in the Pittsburgh Post-Gazette and went nationwide. Its title is "Pro-Lifers Should Support Health Reform." It would not encourage abortions, but it would save countless lives. And he is a health law expert. And he says, as a strong believer in the sacredness of human life, as an educator for 30 years experience teaching healthcare law, I have followed the healthcare reform debate intently. Approximately 45,000 Americans die each year because they are uninsured, and healthcare costs increase annually for almost all of us. Many in Congress have been working hard to solve this crisis, but now erroneous claims about the issue of abortion, a matter of tremendous moral concern, are threatening to derail these efforts. The Senate bill, like the House bill, prohibits the use of federal subsidies to pay for abortions in situations where federal funding of abortion is now permitted under the Medicaid program, the cases of rape, incest, or physical threat to the life of a mother. The Senate bill creates a new community health center fund of $7 billion. Some have argued that this money may go toward abortions. However, this money must be spent through the Department of Health and Human Services, which is subject to the Hyde Amendment, which prohibits federal spending on abortion. And finally, he says, in the endless debate about abortion is the fact, often lost in this endless debate, and the Senate bill would cover 30 million uninsured Americans, thousands of whom will otherwise die prematurely every year because they lack health insurance. It would be doubly tragic to deny them the care they need on a misunderstanding of health care reform's effect on abortion policy. A principled, pro-life stand on health care reform must rest on accurate arguments as well as a deep concern for life at all stages. We should accept the word of people who are experts in the healthcare industry, like the Catholic Health Association. We should listen to people who have examined this very, very carefully, day in and day out, and who have made comment on this. Perhaps this has something to do with the fact that, with very few exceptions, the most vocal proponents of this amendment are the exact same individuals who want to see our health reform package fail at any cost. As I said last November, this amendment goes well beyond existing law. It disallows private insurance companies who operate in the new exchange from covering abortion services in plans that receive government subsidies. In other words, it attempts to bar women from access to an abortion, even if they pay for it with their own money. It invades women's personal decisions. It discriminates against working women, and it violates the law of the land. And I urge my colleagues to oppose this amendment.